Hi, good morning. My name is Annie Omoni. I'm a student at Chamberlain University, Tyson Corner. This morning, I'll be performing a wound dressing change on a patient in the hospital. And before I start the wound dressing, I would like to show the four corners of the areas that I'm using for my demonstration. Okay, thank you. Now I'm gonna go introduce myself to the patient. I am now in the patient's room. Knock, knock. Hi, hand hygiene. Good morning. My name is Annie. This morning I will be performing a wound dressing. I'll be changing your dressing this morning. Okay, so before we start, can I just verify your two identifiers? Tell me your name and your date of birth. Let me check your name back. Okay, okay. Thank you very much. Okay, I've already gone to verify your doctor's order. I've verified the doctor's order, and the order tells me that I should be doing a wound change this morning. Take away the old one and put it the new one. Now, are you in any pain? Any allergies? Okay, no pain, no allergy. That's good, because I just asked to see whether you will need a pre-medication. Okay, now I'm going to provide privacy, and then now that I've provided privacy, I just want to explain to you about the procedure. Okay, the procedure is going to take us like 15, maybe 20 minutes or less for the dressing. And the purpose of the dressing is to just make sure your wound stays clean and free from infection, and also to promote wound healing. Do you have any questions for me? Okay, do I have your consent to do your wound change? Oh, thank you very much. So you have given me the consent. Okay, now I'm gonna raise your bed to my hip level, and after I raise my bed to my hip level, I've already prepared all my supplies already have been prepared. I have my supplies on a clean table that have been wiped with antibacterial saline cloth, so they are all there and all prepared. So now what I'm going to do, I'm gonna put the side rail down, and after I put the side rail down, I'm gonna do my hand hygiene. So I'm doing my hand hygiene, and now that I've done my hand hygiene, I want to put my trash receptacle, and then I'm gonna don my clean gloves. So I'm donning my clean glove, and then I'm gonna put my absorbent part underneath. So this is my absorbent part I'm gonna use. Put absorbent part underneath the wound where I'm gonna do the wound dressing. Then I'm gonna expose the site. So now that I've exposed the site of the wound, keep patient covered and not to expose the patient, just the side that I'm gonna take care of. So I'm gonna peel off the dressing gently, the tape from the skin gently, 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 and then I take it off. Now I'm gonna examine the gauze that are the AVD part where I took the wound from. It's a wound on the thigh here. So I'm gonna examine it and look at the back and look at the drainage is moderate, and I sniff it, but there is no odor. So now that I've looked at it, I'm gonna examine the wound itself. So I'm gonna put that in the trash. So looking at the wound, I'm examining the wound. The wound is the wound looks clean. There's no scar in the wound, and there is no slough. And then looking at the wound, the edges around the wound are clean and round and even. And inside the wound looks pink, so I'm checking for color, I'm checking for odor, consistency, and also the amount. So the amount of the drainage is moderate, and the drainage is a serosanguinous drainage, no odor. So right now that I've examined, I'm gonna do my wound measurement. So here is my Q-tip. I'm gonna take my Q-tip out to use for tunneling, and then I'm gonna trash that. And then of course I've already prepared my measuring tape, so I'm gonna measure the wound. So here I go using the centimeter of the wound measurement. So we go here, I measure the length, okay, and then I measure the breadth. If I could not get it very well, I'm gonna use this Q-tip to go measure the wound, and then I will just go against the, alright, 4 is the length, 4 centimeters is the length, and then the breadth. Okay, I'm gonna use my Q-tip. Okay, and then I'm gonna measure, and that looks like a 3, so 4 by 3. And then I'm gonna also check for any tunneling. So I can see there is tunneling here on the, this is 12 and this is 3, like 3 p.m. or 3 p.m. Arrow is on the 3, so that's where I have some tunneling. So the patient will need packing, and then I will get rid of that. So now I've measured it, I've known where the tunneling is, so now I'm gonna prepare myself for the wound chain. So I'm gonna take my clean gloves out, I'm gonna pinch it from the middle, and then go from inside and then into the trash. And then I'm gonna do hand hygiene. Now that I've done hand hygiene, I'm gonna prepare, don my PPE. So I have my PPE here. So this is my PPE here. I'm gonna don my PPE. There's a spot that is torn, but it's because of the overuse. But just assume that nothing is torn. Then I'm gonna start with my head, and then tie the back. After I tie the back, I'm gonna put my face shield and my face mask, and shield. So that's gonna go this way. Okay. I'm gonna pinch just a bit. Okay, and my face shield. So my glass will represent the face shield. And then after that is done, I'm gonna prepare my sterile field. So I'm gonna do hand hygiene, and then I'm gonna prepare my sterile field. So I'm gonna open from the dressing tray away from me, and then after that is away from me, I'm gonna take my sterile glove out first, just touching the border, and just put it, open it, make sure just touching that 1 inch area. Okay, so now that is done, I'm gonna start with my non-dominant hand and the dominant hand. This is my, I would say, sterile hand and the clean hand. So I'm gonna start with my clean. Start with my clean hand, my sterile hand. Then from the outside, make sure it doesn't touch. Okay. Then I'll go inside. So I have my sterile gauze on. Now that I have my sterile gauze on, I'm gonna prepare my sterile field. So I have my sterile pad in here. I'm gonna pick it up from the edge. Make sure open it, just touching the outside of the border. That, assuming that paper is not there, but if it's there, it's a sterile paper that the glove came out from. I have a 1 inch or 1 centimeter, I believe, area, the field that is contaminated, so that is considered contaminated, that should not come in, that nothing sterile should be around that area. All the sterile material should be in the center of the sterile field. So I'm gonna take everything one by one. I'm gonna take this is my sterile hand, put my clean wrap, my tape, gonna pick my Q-tip, and then I'm gonna put it in here. Most of it is inside the sterile field. So, and then I'm gonna do the same thing for the scissors. The tip is inside the sterile field. And then I'm gonna do the pad and any gauze that comes with it. Hand is still sterile, so I put the everyday pad there. And the sterile gauze, I want to still leave it inside. Still my hands gloves are still sterile, so I want to leave it in there. I don't want to take it out. Then I'm gonna take my sticker. Oh, excuse me. My sticker, labeling sticker out. So now that is done, I have my normal saline here. I'm gonna take it out and I'm gonna open it. So I'm gonna open it, get trash the cover, and then I'm gonna open and put in the trash. And then I'm gonna come pour my sterile water for everything. Assume everything is poured in. Make sure it's not splashing, and then I will trash. After that is done, I assume I have my 60cc syringe, sterile syringe. So before that, I'm gonna use my sterile hand to get pass it to my clean hand, and then I take the syringe with my sterile hand, because the syringe is sterile from a sterile container, I assume. And then I'm gonna withdraw 35 to 60 ml of water, and then I will come and then I will irrigate the wound. So with my gauze on the side, just making sure that the irrigation is right inside the wound, not touching outside of the skin. And then this gauze is used just to help. I have my absorbent pad already there, but just to make sure the patient is not wet or messed up. So now that is done, I'm gonna trash both the sterile gauze and this in there in the trash receptacle. So now that is done, I'm gonna use my sterile hand and pick up a gauze. So I'm gonna pre-pack I'm gonna prepare my packing gauze. So I will dip it inside, squeeze, it's ready. Then I'll put it in the area, the dry sterile field slot of the tray. Now that is done, now I'm gonna clean the wound. So this is my sterile hand. I'm gonna take the four corners of the border, hold them together like this, dip inside the sterile water, squeeze, and then after that is done, I'll pass it to my clean hand. Make sure they don't come in contact with each other, and the cleaning is inside out. So I'm gonna go inside, make sure I clean from inside, see, like that, and then trash. And take another one, soak, squeeze, pass it to the clean hand, and continue from where I stopped inside, and trash. Make sure I do just one and clean one way and one time, not going back and forth. Now that is done, I need to do my packing. So my gauze has been pre-packed. So I'm gonna, this is my sterile hand, I'm gonna pick it up from the sterile field, pass it to my clean hand from here, and then I'll use my sterile hand to pick up the gauze. I'm gonna make sure I open it, and then I'm gonna pack. So make sure everything is packed inside the wound and not outside, it's not touching the wound. So safe, just assume everything is inside is not touching the wound, the skin. Everything is well packed, and because this gauze is wet to moist to dry dressing, which helps to debride also. And after that is done, I trash that. Then I'll use my sterile hand to pick up a clean gauze, a sterile gauze, that one, and put a sterile dry gauze on top of the wound. And once that is done, now I'm gonna use my ABD pad. My ABD pad was within the sterile field, so I'm gonna pick it up, and then I'm gonna pass it on here and cover the wound with the ABD pad. So now the wound is dressed. I'm gonna take my tape, which I've already prepared tape, and then tape my wound. Take the other one, tape across, and make sure it is well suited, is well suited. So the wound is dressed and the wound is covered. So now what I'm going to do, I'm going to make sure I get rid of all the stuffs that I use. I'm gonna get rid of my absorbent pad, and then get rid of my trash. Now assume that everything is out of the way. Everything is out. I'm taking my trash out. So I have my bigger trash, which is close to me here. So now I'm gonna take my gloves out. So I'm gonna pinch it from the center and make sure it doesn't come in contact with me. And then I will go underneath, and then I'm gonna trash it away from me into the bigger trash, because all the other ones are gone. Now that is done, I'm gonna do hand hygiene. After hand hygiene, I'm gonna take my gown out from the back first, then over the head. This is out here, over the head. And then I'm gonna shrug my shoulder and make sure I get it out without touching the outside coming in contact with me. And then wrap it around and trash. Now that is done, that brings me to the end of my dressing. I'm gonna do hand hygiene. After my hand hygiene, I'm gonna grab my sticker. It's still here within. Then I'm gonna pick my sticker, take my pen, put the date, the time, and initial, and tape it. And now that is done, I'm gonna make sure I cover my resident bag, keep her warm and comfortable, or patient. And then once that is done, I'm gonna reassess patient, because I've already done my hand hygiene. PO, how are you? We have come to the end of the dressing. Are you in any pain right now? Do you have any questions for me? Okay, no questions for me. Okay, thank you. I'm gonna lower the bed down. After I lower the bed down, I'm gonna put the handrail up, and the handrail is up. Once that is done, I'm gonna do hand hygiene, and then give patient call light. Here's your call light. Please call if you need me, okay? And I'll be back here to help you. Now that the wound dressing is done, I just want to give you just some teaching guidance to just advise you take all your supplements that the doctor ordered for your wound healing. Your vitamins, supplements, take them, and the food also. Take all the food that is ordered for you to take to help you with the promotion and the healing of your wound, okay? Thank you very much. Now that I've reassessed and give a teaching to the patient, I want to take my face mask off I would have done that before, but I can take it now out with my face mask and my face shield, and it goes to the big dirty receptacle that was there. And then I will do hand hygiene again. And now that my hand is clean, I'm gonna go out to do my wound documentation. I will talk about, you know, the patient was the right patient, and the right chart. I make sure it's the right chart I have with the right patient. I will document the, you know, the measurement of the wound. I will talk about, you know, the condition of the wound, whether there was eschar present or eschar or slough. And I'll also talk about the, you know, the color of the wound, the odor. There was no odor. Talk about the consistency and the amount of the drainage, which was moderate. And I give a health teaching to the patient also, and I will date, and I will initial date and time, and initial my documentation. And after that is done, then that brings me to the end of my wound dressing. And I want to thank the patient. Pure, I want to thank you for this privilege and the opportunity you give me to do your dressing, and thank you for how you responded to the dressing. So patient responded very well to the dressing chain with no further pain or anything. So thank you very much.